give you an imagery of the nervous system. And next day I'll be lecturing on subdural space, meninges. And today just get a glimpse of the window to the nervous system. Now, next. Tell me, where is fancy bread? Hey. Tell me, where is fancy bread, in the heart or in the head? Shakespeare. Tell me, where is fancy bread, in the heart or in the head? Shakespeare. Although Shakespeare asked this question near the end of the 10th century, the answer had been known at least to some for more than 2 millennia. Many ancient Greek scholars, Hippocrates and Plato among them, appreciated that there is something special about the brain and argued that the brain is responsible for behavior in humans and other animals. We now take it for granted that brain is the organ that obtains information about the environment, processes and stores this information and generates behavior. In addition, it is the brain that is responsible for such vaguely defined aspects of behavior as feeling, aspiration and abstract thought. Those qualities we consider with more than a touch of hubris quietly, essentially human, like feeling, aspiration, and all these feelings are only human. Diseases of the brain, which often are associated with the aging and hence are on the increase as the human lifespan lengthens, cause untold suffering for individual families and society as a whole. In essence, then, it is the brain that makes up what we are, and indeed it can be argued that all other organs are there simply to support the brain. For this reason, understanding the biology of brain function is a major goal of the modern science. The brain is one of the last great frontiers in biological science, and the unveiling of mysteries is comparable in complexity and intellectual challenge to the search for the elementary particles of matter or effort to explore space. Now, this is how important is the nervous system and the brain. Now, human embryos of different yard length. You can see the miniature. This is small embryo here and different length. And these are the brain, the skull bones dissected out and exposing the brain. Next. Next. Now you can see the skull bones and the cartilages are removed. You can see the two lobes of the brain. This is the brain is opened, and you can see the ventricle. This is the brain, right and left brain. This is the fourth ventricle. Next. Now you can see this is the dissected brain and spinal cord of human fetuses. It is the fetal brain with the spinal cord that has been dissected with different yard length fetuses, human fetuses. I presented a paper on this. Naturally, this was dissected, and the spinal cord you will see in 35th Gray's anatomy. You can see this dissected. Next. Similarly, the fetus here. Now, areas of the brain. The prefrontal cortex, Broca's area, premotor area, motor cortex, primary somatic cortex, parietal lobe, gustatory area, Rignis area, primary visual cortex in the posterior occipital lobe, optic radiation, and cerebellum. This is the cerebellum. Brainstem, this is the brainstem. Primary auditory cortex, this is the primary auditory hearing, and left cerebral hemisphere and left middle cerebral artery. This is left middle cerebral artery supplying the brain. Next. This is the major external part of the human brain, underside. When you get the brain and the viscera, you ask to say, you see the undersurface. And this will be the picture. This will be the picture, the frontal lobe, olfactory lobe, temporal lobe. Yeah. The frontal lobe, olfactory lobe, temporal lobe, pons, and this is the optic chiasma, and this is the cerebellum. Now you see the cerebellum, gross anatomy, consists of cerebellar cortex, deep cerebellar nuclei, white medulla in between. Cerebellum is uninterrupted across the midline. The cortex thrown into numerous transverse folds called folia. This is the folia. This is the folia. And fissures, separated by fissures. The white gray matter of the medulla resembles a branching tree called arbor vitae. Next. Hey, Puntarak. Now, location of the cerebellum within the posterior fossa. This is the cerebellum location. Here is the cerebellum location, and straddles the brainstem and forms the roof of the fourth ventricle. And tentorium cerebelli neuromatter separates the cerebellum from the occipital lobes of the cerebrum. This is the cerebrum. This is the cerebellum. This. And you can see, next. Now, parts of cerebellum, you can see the pair of cerebellar hemisphere. This is cerebellar hemisphere united by vermis. Next. Now, you will be, when you will be reading cerebellum, you will go into detail. Next. Similarly, next. The parts of the tuber, pyramid, uvula, nodule. Next. Now, Larson's lobes. When you go into detail in the cerebellum, next will be, these are the tracts and connections of the cerebellum. Next. The afferent connection. Next. Now you see this. Now classification, phylogenetic and ontogenic development, archicerebellum, paleocerebellum, neocerebellum. Classification of afferent connection, vestibulocerebellum, spinocerebellum and pontocerebellum. Classification of efferent connection, vermis, paravermal region, cerebellar hemisphere. Now, deep cerebellar nuclei, you can see these are subcortical collection of gray matter arranged lateral to medial, dentate, emboliform, globose, fastigial, interposed in between emboliform and globose. Okay, next. Now, cerebellar peduncles. See the middle cerebellar peduncle, superior brachium, cerebral peduncle here. This is the pons. This is the medulla oblongata, middle varium pontis, and inferior restiform body. Next. Blood supply, arterial supply, superior cerebellar artery, anterior inferior cerebellar artery, posterior inferior cerebellar artery. Venous drainage. Venous drainage, superior cerebellar veins drain into the straight sinus, and great cerebral vein transverse and superior petrosal sinus. Inferior cerebral veins drain into the sigmoid, inferior and petrosal occipital sinuses. Next. Now, functions of cerebellum. The cerebellum is the head ganglion of the proprioceptive system, since it receives impulses from the muscles of the limbs, trunks and faces. Now, this is the proprioceptive. If cerebellar ataxia, the person who walks, his gait is in this, is of this nature. Next. Now, functions of cerebellum: balance. The balance you are having the different acrobatics, and your in the circus, and also during dance. Now, it guides the motor cortex functions of cerebellum. Motor cortex and controls all voluntary movements, so that there may be accurate in time, force, duration and extent. It exercises all kinds of final editorial supervision over the motor impulses emerging from the cerebral cortex. Now he is playing at table tennis and the motor skills. Now next. Functions of cerebellum: it exerts synergic control. The control of cerebellum is ipsilateral. The flocculonodular lobe is concerned with the control of cerebellum. The anterior lobe is concerned with the lower limb. The central lobule is concerned with the face. Now, cerebral ataxia. Ataxic gait and position, left cerebral tumor. If there is a left cerebral tumor, then the patient will walk in this way, sways to the right in standing position, steady on the right leg and unsteady on the left leg, and ataxic gait. Next, cerebellar lesions: ataxia, hydrocephalus, hypotonia, pendular knee jerk and asthenia, asynergia, loss of muscular coordination, defective synergy between agonistic and antagonistic, dysphagia, past pointing, decomposition of movement of finger, nose, chest, and dysdiadochinosis, rebound phenomena, slap one face, dysarthria, dystagmus, intention to tremor. Next. The eyelids display oscillatory movements when the eye are fixed on an object. Now, if you see an object in a fixed eye, then this thing will just move like this. And also, the eyes tend to deviate from control position 10 to 30 degrees to the opposite type. Now, 10 to 30, when you test, you will see that it will just 10 to 30 degrees in the control position. Next. Now, is a cerebellar medulloblastoma. The cerebellar tumors on vermis. Child in this picture would not try to stand unsupported, would not let go the bed nail if she was put on the floor. Now, this is the condition. If any child comes and you is unsupported, she won't stand up or she won't move. Now, the cranial nerves. You will be encountering the cranial nerves in the head neck dissection, and today you just know the names. Olfactory with the first cranial nerve, second is optic, third is oculomotor, fourth is trochlear, fifth is trigeminal, sixth is abducens, seventh is facial, eighth is vestibulocochlear, and ninth is glossopharyngeal, 10th is vagus, and 11th is accessory, and 12th is hypoglossal. Now these olfactory, smell, optic nerve from the eye, oculomotor, trochlea, you will be related to the hearing, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. This is cranial nerves. Next. Cranial nerves, sensory nerves, one, first nerve, second nerve, and eighth nerve. Motor nerves are third nerve, fourth nerve, fifth nerve, and 12th nerve. Mixed nerves is fifth nerve, seventh nerve, ninth nerve, 10th nerve, 11th nerve. Now, one thing is that what are the cranial nerves? It can be a short note and name them, and also which are the nerves which is acting as a sensory nerves, motor nerves, and mixed nerves. This is the undersurface of the brain. You can see where the nerves emerge from. This is the olfactory, this is the optic nerve, this is the trochlear nerve, abducens nerve, facial nerve, glossopharyngeal, and hypoglossal nerve, and vagus nerve. Similarly, olfactory, oculomotor, ophthalmic, and maxillary nerve, mandibular nerve, trigeminal nerve, vestibulocochlear nerve, and accessory nerve. In the brain organ, all these nerve roots are visible. Now, again, it's a repetition, and this is the olfactory, oculomotor, this is the optic, this is the trigeminal, this is the cochlear, this is glossopharyngeal, 9th nerve, and 10th nerve, 11th nerve, 12th nerve. Next. Now, olfactory nerve, how it looks in the sagittal section of the skull and the face. You can see the distribution. Next. Now, optic nerve, see left visual field, right visual field. The optic chiasma, it crosses right eye, left eye. Optic chiasma is here, and brain, see the few fibers from this side, and this side it goes to the left eye, this goes to the right eye. Similarly, from the right eye, few fibers is gray. Okay, this is distribution in the optic nerve. Next. Now, trigeminal nerve, trigeminal, naturally ophthalmic nerve, maxillary nerve, mandibular nerve. This is the areas where it supplies the good illustration. Next. Now, this is very important. You can get a full question on facial nerve, and you can see the it is like this. You just, when you are reading, what are the branches, you can put your hand like this. Now, vestibulocochlear nerve. See the cochlear apparatus here. This is the brain. And this is the cupula. External auditory signals, and then it goes to the vestibulocochlear, the cochlear apparatus, and then goes. Next, hypoglossal, glossopharyngeal. Now, this is the brainstem, the glossopharyngeal nerve, it goes to the tympanic membrane, and over here glossopharyngeal nerve, and the tongue. That's why when you have a hot chili, then you see the boleda, je kan diye dhumo berochche. When your the tympanic membrane is supplied, so you feel that this is the vagus nerve. Now, branches of the vagus nerve is here, goes to the thoracic cavity. Now, tracts of spinal cord, hypoglossal, this, eta taka. Next. Now, see, hypoglossal, this is the hypoglossal nerve. When you dissect, you will be seeing, and you will be asked to write a short note on hypoglossal nerve. Then you illustrate like this and see the internal jugular vein, the carotid artery, this is the hypoglossal and the tongue. Now tracts, when you tracts of the spinal cord. The spinal cord, from the brain, it descends and descends, the spinal cord, the tracts. Now this is important, you will be knowing when you read further. Next, ascending tracts, receptors. Now, exteroreceptors, proprioceptors, interoceptors, non-encapsulated, encapsulated. Meninges corpuscle, Pacinian corpuscle, these terms you have to know. And this is next. Now, ascending tract, see the spinal cord, the sensory ending is here, and it's a tract like this, ascending tracts. That can be in physiology or in anatomy. You will be any lesion in the ascending or descending tract, what will be the effect? That can be questioned. Now, next. Now see lateral spinothalamic tract. Describe the lateral spinothalamic tract. Now you have to draw like this figures, and the pain and temperature, alpha, delta and C fibers. Next, in physiology this will be taught to you. Anterior spinothalamic touch and pressure, crudely localized. This is. Next, posterior spinocerebellar tract. See the posterior spinocerebellar tract. These are the tracts, and any lesion in any level that will be reflected with the posterior spinocerebellar tract, third lumbar vertebra, muscle, spindle, Golgi tendon, organs, unconscious and proprioceptive touch, pressure, posture and movement. Next, anterior spinocerebellar tract. Now posterior column tract. This is the picture in posterior column tract. Next. Now posterior column tract is the proprioception, vibration, fine touch, 2-point discrimination, tactile localization, stereognosis. Corticospinal tract, skillful voluntary movement of non-postural type, speed and agility, modulate sensory input, smooth performance of movement, flexor muscles of the distal parts. Next. See, this is the picture of the corticospinal tract. Rubrospinal tract. These are nuclei. Rubrospinal tract. This is the spinal cord. Next. Vestibulospinal tract. Vestibulospinal tract. Next. Reticulospinal tract. Olivospinal tract. Next. Tectospinal tract. Next. Olivospinal tract. Next. Lesions of the spinal cord. The spinal cord injuries, traumatic accident, gun shot, fall in the stab wounds, fractures, dislocation, ligament tear. Note, non-traumatic disc prolapse, infection, abscess formation, vertebral subluxation and spinal neoplasms. Next. Now complete transaction above third cervical segment, paralysis of the respiratory muscles, unable to survive. Now if the any lesion on the third cervical segment, then paralysis of respiratory muscles, unable to survive. Now below fifth cervical segment, quadriplegia, paraplegic, complete loss of sensation and voluntary movements. Now if you do a test with your hammer and needle, then you will get the thing, and if this quadriplegia means all the four limbs, upper limb, lower limb is quadriplegia, paraplegia, one-sided, and complete loss of sensation and voluntary movements. Next. Now incomplete lesion anterior cord syndrome, posterior cord syndrome, central cord syndrome, Brown's cord syndrome. Next. Now lesions of the spinal cord is complete cord transaction. This is complete syndrome. This is the anterior root syndrome, the central cord syndrome, and Brown's cord syndrome. This is next. The anterior cord syndrome, these are the flexion injuries, wedge fracture of the vertebral body and injury to the anterior spinal, C4, C7, T12 to lumbar 2. This is the anterior cord syndrome in these levels. So if you see a radiological plate of the LS spine or thoracic spine, you can detect the lesion. Where is the lesion? Next. Now, posterior cord syndrome, rare condition. It's a rare condition. Fracture of posterior elements, avulsion fracture. Next. Now, central cord syndrome, hyperextension injuries, whiplash, congenital or degenerative narrowing of spinal cord, more severe involvement of upper extremities, sacral sparing. Next. Brown's cord syndrome, hemisection of the spinal cord, stab wounds, compression due to extramedullary tumors. On the side of the lesion, damage of posterior funiculus and pyramidal tracts. You just know today what these are the components of the nervous system. Now, on the contralateral side, damage to lateral spinothalamic tract. Next. Now, Brown's cord syndrome, lesion on this side, total loss of sensation and tactile discrimination and proprioceptive sensation, spastic paralysis, a loss of pain, temperature sensation, impaired tactile sensation. Next. Upper motor neuron lesion. Now, you will be asked in physiology or in anatomy what is described in brief the upper motor neuron lesion. Then you have to put it into these headlines: pyramidal tracts above the decussation and contralateral side, below the decussation and ipsilateral side, loss of voluntary movement, spastic paralysis, loss of superficial reflex, exaggerated deep reflexes, Pabnicis sign positive and chlorus. Next. Lower motor neuron lesion, complete degeneration of the ventral root fibers, trauma, infection, neoplasm, flaccid paralysis, loss of all reflexes, fibrillation and fasciculation and atrophy. Next. Syringomelia, cavitation and glycosis in the central canal, cervical region. Clinical manifestation of the spinal cord lesion. When you go, you will be in this total spinal shock, period of areflexia, abrupt withdrawal of connection between higher contents and centers to spinal cord, loss of all reflexes, flaccidity, loss of all sensation below the level of the lesion, subsides within 24 hours, may last for several hours to several weeks, spasticity, motor and sensory impairment, bowel and bladder dysfunction, and secondary complications, pressure shoes, autonomic dysplexia, postural hypotension, contractures, and deep vein thrombosis. Now, if a man comes with any injury on the spinal cord, you catheterize the bladder. So you can see the urine, and time to time you ask the attendant to turn the patient about. So that does not get any pressure shows. Next. Now, blood supply of the brain, the arterial supply of the brain is derived from two pairs of vessels, internal carotid arteries and the vertebral arteries. Now, the internal carotid and the vertebral arteries. Next. Now, internal carotid artery, you can see, gives to the following branches: middle, anterior and cerebral arteries, anterior choroidal arteries, posterior communicating artery. Now, the blood supply of the brain is a very important component, and you will be asked questions. It can be a blood supply of the brain. Now, next. Now, Circle of Willis. This is an important, the Circle of Willis, that is supplying the brain, and you can see the blood. This is the optic chiasma. And when you go for seeing the brain and the dissection, then you can see, and this can be a full question of 10 marks. Now, Circle of Willis. Next, the anterior, middle and posterior cerebral arteries give rise to two sets of branches, cortical and central. Next, central branches consist of 6 main groups: anteromedial, posteromedial, right and left anterolateral, right and left posterolateral. The total brain that is supplied, and anteriorly, anterolateral, anteromedial. In this description, you have to know. And next, now cerebral cortex is supplied by cortical branches of the anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. Next, now this is the cortex hemispheres, middle cerebral arteries, posterior cerebral artery, anterior cerebral artery. Next, now arteries supplying the internal capsule. Now, blood supply of the internal capsule, or describe the internal capsule. Now, where most damage occurs in the internal capsule. Now, arteries supplying the thalamus. When you read the nuclei, there are nuclei. Thalamus is one of the major component. And when you are seeing some CT brain, CT brain, then they will be describing the thalamus, or any there's a problem with the thalamus or not. In the internal capsule, they will describe that that is hemorrhage. Next, now the arteries supplying the corpus stratum. Next, arteries supplying the brainstem and cerebellum. Next, blood supply of the spinal cord, anterior spinal arteries and posterior spinal arteries. Next, veins of the brain, they are classified as veins of cerebral hemisphere, cerebellar veins, veins of the brainstem. Next, now you can see the cerebral veins are divisible into external group and internal group. Now next, now internal cerebral vein, basal vein and greater cerebral vein. This is the basal vein, this is great cerebral vein, internal cerebellar vein, choroidal vein and thalamic veins. Now next, veins of the brainstem, mid-brain drains into the cerebral veins, pons upper part into basal vein, medulla oblongata into the transverse and occipital sinuses. Now medulla oblongata drains into the transverse and occipital sinuses. Next, veins of the cerebellum, superior petrosal sinus and great cerebral vein, and straight sigmoidal, occipital and inferior petrosal sinus. The sinuses will be on another class, and the venous drainage, actually, when you see the skull, you will see the impression of the sinuses on the bone. Next, now dural venous plexus. Dural venous plexus. See, this is how it all drains into the internal jugular vein. See, this is how the brain is drained out. Next, now pterygoid venous plexus. Now usually when you are studying the skull bones, there will be pterygoid plate of the maxilla, and from there you can see this venous plexus. This part here. This is the maxilla. This is the pterygoid plate. When you study skull, you take a whole skull and also a skull in sagittal section. You see it and you just observe you have the skull and the sagittal section skull, and the maxilla and the bone, you have it in front. In the dissection hall, you just correlate the next. Now meninges of the brain, see this meninges of the brain. This is the skull, durameter, the periosteal layer and meningeal layer. Now arachnoid villus, this is arachnoid matter, blood vessel is here, and then pia matter. And brain, grey matter and white matter. This is the white matter, this is the grey matter. When you see a section of the brain, you can delineate or distinguish between the white matter and the grey matter. Next. Now ventricles of the brain, you can see when I showed you the fetuses, even the thing that the ventricles, your lateral ventricles, then fourth ventricle. Next, third ventricle of the brain, this is third ventricle, two lateral walls. And now describe if it will draw a picture and illustrate or draw a picture and label it, the third ventricle of the brain. 5 marks. Okay, now what is it? It has the two lateral walls, anterior wall, posterior wall, floor, roof and cavity. And it has an ependymal lining. All ventricles are lined by ependyma. Next. Now lateral ventricles of the third ventricle. Next. Now anterior wall of the third ventricle, fornix, anterior commissure and the posterior lamina terminalis. Next. Posterior wall, roof and floor of the third ventricle. Next. Now hydrocephalus, see this is the normal brain and this is the hydrocephalic brain. See the ventricles are spacious, the skull is big. And next. Now brainstem, it can be a short note composed of midbrain, pons and medulla. Brainstem composed of midbrain, pons and medulla. Midbrain around the cerebral aqueduct, group of cell bodies and tracts connects the cerebrum to the lower part of the spinal cord. Pons situated in front of the cerebellum, nerve fibers that connect the two hemispheres of the cerebellum as well as the brain and spinal cord. Nuclei act as relay stations. Next. Now brainstem, see this is the cerebrum, this is the midbrain, pons and medulla oblongata, and this is the cerebellum, this is spinal cord. Now brainstem, medulla oblongata, between the pons and the spinal cord, white matter, relay station, vital centers, cardiac, respiratory, vasomotor reflex, decussation of motor and sensory tract, the crossover, the decussation, the crossover and the reticular formation, a collection of neurons in the brainstem. Coordination of muscle activity, selective awareness. Next. Now see the brainstem structures, you can see in the brain. You please, when you are given the brain to study, you at least view it once, see it. And now spinal cord, the elongated cylindrical part of the central nervous system, suspended in the vertebral canal surrounded by meninges and CSF, continues above as the medulla and extends from the upper border of C1 vertebra up to the lower border of L1, C1 to L1. This is the length of the spinal cord in the vertebral column, in the vertebral canal, supported by the meninges and CSF. Now, at this level, lumbar puncture, procedure to get a sample of CSF testing done at the level of L1, L3, L2, L3 and L3, L4. Even you can give for spinal anesthesia, you can at this level. Next. Now spinal cord, you see the spinal cord, the vertebral column, the sacrum, and you can see the extent of the spinal cord. This is the spinal nerves, lower end of the dura mater. This is the filum terminale. So next. Now spinal cord internal structure is the anterior median fissure, posterior median septum, central canal in the center, grey matter in the middle, white matter in the periphery. With the cross section of the spinal cord in histology, we have a beautiful slide. When you be seeing it, you can see this whole descriptive part is there. Next, spinal cord, see the cervical nerves, thoracic nerves and lumbar nerves. The seven cervical and thoracic 12 and lumbar 5. Now you see internal structure of the spinal cord. See the dura mater, the spinal nerve, the arachnoid matter, and this is the pia mater. And you can see this is the covering of the spinal nerves. Next. Now spinal cord internal structure, white matter, arranged in columns or tracts, ascending sensory tracts, lateral anterior spinothalamic tract, anterior and posterior spinocerebellar tract, descending motor tracts, anterior and lateral corticospinal tract. You see what is spinothalamic tract, spinocerebellar tract, corticospinal tract. You know today you just know be acquainted with the terminology. Next. And see the spinal cord in cross section. See posterior median septum, posterior white column, posterior sensory nerve root, spinal ganglion, the anterior motor root, and the anterior white column, anterior median fissure, anterior grey column, lateral white column, posterior grey column. Next. Now flexion and rotation injuries. Now you see this type of coolie is carrying a load and suddenly that falls. He may sustain this type of fracture, this type of fracture, this type of fracture. Next. Now crush injury is climbing a ladder, suddenly falls, and this is the condition of the vertebra. He falls like this, then this is the condition of the vertebra, the fracture, multiple fracture of the vertebra. Next. Flexion injury mechanism falls like this, and there is a trauma and fracture in the spine, vertebral column. Next. And this is the extension injury in a motor car, and this is the driver with the steering. If there is an injury, head and collision, then the injury is of this nature. Next. Now chance fracture is this. This is the fracture. This is chance fracture. If you see a radiological plate with a fracture, the radiological plate, X-ray plate of the vertebral column will give you a diagnosis. Next. See lumbar spine. Next, these two vertebrae, this is down. The articulation of the facets and joints. You have read the vertebral column. You have know that the two vertebrae articulate in this way, and in between that there is an intervertebral disc. Okay, next. Now atlantoaxial injury. This is the odontoid process of the cervical vertebra, and there's a fracture here. Next. Tuberculosis of spine or cold abscesses. You can see an abscess over here, and There might be a fracture also, and that is paradiscal, central, and anterior. The CT or MRI will reveal, but in just plain X-ray you can have an idea. Now next, X-ray fine, and there. Now see spinal cord tumor. This is spinal cord. That's a tumor here. Okay, next. Now X-ray spine. This is the spine. This is a fracture. This arrow is a fracture. Next, MRI spine. Next, X-ray spine. Next, this is the MRI. Here. The D9. This is thoracic 9 vertebra. This is a fracture there. Next, brain and surroundings. Next, blood supply and dural venous sizes. Next, it's you have it's a small journey in a big journey, and you just give you the total that these components you have to know, and you don't feel nervous because brain tracts, lesion, the ventricles, and the components where what type of injuries will lead to the typical lesions of the spinal cord injury, and that can be diagnosed mostly the paraplegia, quadriplegia, or any cerebral lesion or cerebellar lesion that can be diagnosed. With this today, I just give you you see the sky through the windows and you see many things. And I'm just naming you the star, the moon, your sun, and the clouds. It is like this, that I just give you a glimpse of the windows to the nervous system. Thank you.